down.
See, this one's completely through. If you hold them next to each other, you can see the difference.
Oh, okay. No, I see. Yep.
Okay. Because, you know, it's pretty much common sense. We need to be able to pull with vacuum the tissue into that tissue chamber before we can spear it.
So how? And so it's made so it's gonna stay in place for 48 or?
It stays in place actually for about 7 to 10 days. Sometimes a little bit shorter, sometimes a little bit longer, and then it just falls off and passes through the GI tract. You don't need to look for it. It falls off from a combination of food passing by and tugging at it, and the regeneration of the squamous epithelium, which, as you know, has many layers and regenerates very nicely and rapidly.
So they can't feel that. They can't.
Some people can feel it, and I'll get to that in a moment. Some people can't. Okay. Well, I'll address your question when we talk about talking with the patient. Okay?
Am I in your way here? Am I in your way?
No, you're fine. Okay, the next thing we do, if everything checks out okay, again, check for kinks. Check the electrodes, check the little soaker bulb, check the trocar pin. The next thing we do is we're going to check the vacuum, because we want to make sure that not only this pump can pull enough vacuum, but this pump in combination with this delivery device can pull enough vacuum for a good attachment. So this is your standard endoscopy suction tubing. Shouldn't be much longer than this, so if you have longer pieces, you can simply cut them in half, because this is just a cut end. Okay? These are replaced for each patient. Okay? So we attach to the vacuum port. Okay? We turn the pump on, and please note we've put 2 little marks on your pump. One is to indicate that the vacuum should always be set to the maximum. Okay?
Especially at higher altitudes.
Especially at higher altitudes, okay, because you just don't get as good a vacuum here. And this is the minimum vacuum that you need to reach. So when you turn the pump on, you're going to close that tissue chamber off with your thumb, and you can see we are just reaching that minimum vacuum, okay? If we were at sea level, it would go much higher. It would go well over 600. Okay? Once you've reached that, take your thumb off, and the needle should fall by 2 small marks. Okay? By the way, please note that this gauge is a counterclockwise gauge. So unlike most of the gauges you work with, which are clockwise, we need to look that it comes past the mark or to the mark in this direction. Okay? There's 2 little keepers here, different sizes, for you to store that. Okay? So we now know this has enough power to do the job. So the next thing we do, I'm going to have to move some of this stuff.